Hi, my name is Celeste Hernandez, and I'm going to do a recommendation report about rehabilitation, inpatient versus outpatient care for substance use disorders. I do attend Texas A&M University Kingsville. My hometown is Kingsville, Texas. I was born and raised here. My major is psychology, and I do minor in criminology. My aspirations is making a positive impact as a clinical psychologist. My that is my dream job. So, what is a substance use disorder? It is a pattern of using your substance like a drug that causes significant problems or distress on your life, and it usually affects the brain and your bodily functions, your behavior, and you have an inability to control your consumption of drugs, alcohol, anything. Over time, it does change your brain function, making it challenging for individuals to stop even whenever you have negative consequences or are aware of the negative consequences. The criteria for substance abuse disorders is cravings to use the substances. You have a strong craving, an unimaginable craving to your drug. You cannot stop thinking about it. You neglect other parts of your life because you are trying to spend so much time to find the product, to find your drug, to find the alcohol that you want. Um, Wanting to stop is like withdrawals. Withdrawals is like you're trying to cut down, you're trying to stop, but it's just super hard for you to not do it. Taking, because you have such a tolerance to the drug, taking the substances, taking alcohol in more larger amounts to achieve your feeling, to achieve your high. Even though whenever you continue to use, you have problems in your relationships, your family dynamics, and especially using substances whenever they put you in danger or you are consuming the drug or alcohol and then going and putting other people in danger and yourself as well. Factors associated with substance use disorder. It could be genetic factors, your environmental stress, your social pressures, your personality traits, your mental health issues. Whenever you have family history of addiction, um, whenever you have family history of alcoholism, that's a very big factor that plays into why so many people have substance use disorder. It could be cultural, it could be society. Um, there's not just one factor contributes to it's all factors that contribute to having a an addiction to drugs or addiction to alcohol. Substances associated with substance use disorder. It can be alcohol, marijuana, which are the two major addictions that most people have. Prescription medications, methamphetamines, cocaine, opiates, hallucinogens, and inhalants. Diagnosis of substance use disorder. To be evaluated, you can see a psychiatrist, a psychologist, or a licensed counselor who specializes in drug and alcohol addiction. You can go to a medical doctor, your primary doctor, which then they will refer you to someone who has this specialty in drug and alcohol addiction. Healthcare professionals may use blood or urine tests to check for current drug use, and but there is no lab test, no test to confirm that you do have an addiction. So the best results for you to get diagnosed with a substance use disorder is to see a psychiatrist or a psychologist. The severity of substance use disorder. The DSM does classify substance use disorder in three categories, which is mild, moderate, and severe. If anybody does not know what the DSM-5 is, it is a diagnostic and statistical manual of mental disorders, the fifth edition, which is the most recent edition. It is a handbook for diagnosing mental disorders in adults and also in children. Whenever we do have the severity of your substance use disorder, the mild is 2 or 3 symptoms, moderate 4 to 5 symptoms, and severe is 6 or more. Whenever they do have symptoms, it's usually just how long have you had this problem? How long have you been using the drug? For years, for months, for weeks? How much? Is it every day, all day, 24/7? How often is it compacting your life? Treatment, inpatient care. You will have 24/7 supervised care. It will be medical professionals who monitor their patients to ensure their safety. You will have structured daily routine. You have therapy sessions, educational workshops, and it helps build your stability. It will be scheduled. Detoxification, you will be detoxed once you enter the facility of your addiction, of your drug use, or your alcohol use. The medical and holistic support, it is for the detox assistance. It helps with your nutrition. You can ask for guidance. And mental health care is one of the biggest support medically that they do have, and they will have peer and professional support. You will have groups that you will find friends in or find companions that will help you recover, help you with your journey. And transition planning. Transition planning is just an extra program that they offer to assist you in having an aftercare program. Treatment for outpatient care. You will have scheduled therapy sessions, and outpatient care is typically for people who have daily responsibilities, such as work, school. You are a parent. So, this scheduled therapy sessions will be on your own time. You choose what time you will have these sessions. It is more convenient than the 24/7 care or supervision. Um, it could be set times each week, set times each month. Usually, these sessions have coping strategies, address your problems related to social psychology, um, your psychological or your emotional. Uh, the medication assistant treatment, MAT, it's to help you the ease with your withdrawals. It helps manage your cravings. They do provide you medication for those. And support groups and peer counseling is you will find your own support groups, your AA meetings, your 12-step programs. You find your own groups that you would like to participate in and may help you with your recovery. Telehealth is one of the biggest things of outpatient care because it's virtually. You could do it anytime, any place, and it's more convenient for people that do have daily lives. And one of the biggest, I want to say, um, uh, options for outpatient care is that it's less costly. You have flexible treatment plans. You can pay um, however much you want to pay. There's even programs that are free depending on your income, and there is options for you to have the care that you need if you seek it out. Why is rehabilitation so important? It does help physical and mental health recovery. You will have approaches like the cognitive behavioral therapy, which does help you identify your and recognize and change your negative thought patterns that contribute to addiction. And dialectical behavioral therapy is just talk therapy. You will have the ability to regulate your emotions. You will have the ability to distress yourself, uh, and find your stressors, your triggers. You will have interpersonal effectiveness. You will have the breaking down of dependency of the drug, of your alcohol. These strategies help you uh, get coping skills to further your recovery, to help you rebuild relationships, to prevent legal and financial consequences. It encourages you to have personal growth. Seeking help is one of the most mature things that you could do for yourself. If you want to change, the first step is asking for help. A major thing is reducing overdose risks for people who have addiction. It is the number one death that we have when it comes to addiction. Overdose in on drugs, on alcohol. Um, it's very difficult for loved ones to see that their child or their loved one is suffering. And promoting long term sobriety, it's very difficult to obtain. It takes practice, it takes dedication, and it takes all your strength. If you can overcome your addiction, you can overcome anything. Why did I choose this topic? I chose this topic because I am very personally tied to addiction. Um, I have not had an addiction, but I do have friends, family members, people that are really close to me that have lost their lives over drug use. And to spread this awareness that there is options for you to seek help, there are options for you to recover if you really wanted to. And it just helps me, calms me really, to make this report for people that need encouragement and advocation, because some people need a little push in life, and these options are for you to take advantage of and to use. And I would just love to help people any way I can. These are the sources I used. I used online sources like The Very Well Mind and John Hopkins Medicine. I used journals, the relationship between patient-centered care for substance use disorders and patient outcomes. I also used another journal, substance abuse intensive outpatient programs, to find really good evidence on how these programs really affect people and how they can be very effective. My recommendation report on rehabilitations for options for individuals with substance use disorder and comparing the inpatient and outpatient care provides essential information to consider based on your severity of your addiction and the type of substance used. Inpatient care is typically recommended for people with severe addiction, and the most effective way to overcome your addiction is in the early stages. Ask for help as soon as you notice these issues in your life. And this type of care reduces cravings because of your structured environment, away from the triggers, away from the stress, and you have immediate access to medical support and counselors who are willing to help you overcome your situation. Long-term success in inpatient care is often linked to well-programmed, well-organized aftercare. This could be AA meetings, group meetings, any meetings that you find that will help you stay and reduce relapse. Outpatient care is generally suited for individuals with mild addictions. Um, it proves effective when the patient's environment is stable and you have a very strong support group who is willing to help you and is willing to encourage you to continue. High levels of engagement is one of the most qualities you need to have improved outcomes. Uh, you need to be dedicated, you need to practice, you need to study, you need to find that um, strength inside yourself to overcome anything. The process may take a little bit longer than inpatient care, but it's so much worth it whenever you can overcome your addiction.